We tend to think of COVID-19 as a respiratory virus, kind of like the viruses that cause colds and flu. One of the things that has made treating this new disease challenging, however, is that the respiratory system cells in your lungs are not the only cells that can become infected by the SARS-CoV-2 virus. In fact, cells in the nerve cells, cells in the heart and blood vessels, cells in the liver, kidneys, intestines all have ACE2 receptors, those receptors that the virus can attach to. Doctors are finding that some of the most dangerous symptoms of COVID-19 are caused by infections in these organs. And so it's been a learning process for them. They kind of started out thinking they were treating something like a cold or flu, but this affects other body systems in ways that cold or the flu normally affects. Now, interesting thing about this, since the SARS-CoV-2 virus is made up of lipids with proteins attached, they can be destroyed by soap. That's why hand washing is such an important part of preventing the spread of COVID-19. Soap actually works on bacteria and viruses by breaking the phospholipid bilayers that form their outer coats. Your cells have phospholipid bilayers on the outside, but your skin is made up of multiple layers of dead cells that are always being replaced by living cells from beneath the surface of your skin. And soap breaks down the viral and bacterial cell, and it also releases the dirt and oils that the viruses are embedded in on your skin. Okay, so soap is even better than hand sanitizer at killing SARS-CoV-2 viruses, although hand sanitizer is a good second choice if soap and water are not available. Fortunately, in this class, we have 3 sinks and plenty of hand soap in this classroom. So we're going to take the opportunity to wash hands, certainly at the beginning of the period when you come in each day, and hopefully at the end of the period if we have time, if we're able to get it done that way. So we'll take advantage of that opportunity that you might not have in other classrooms to help improve your overall hygiene throughout the day to prevent the spread of this virus. Okay, so here's a picture that kind of shows what that soap is going to interact with. It actually interacts, to break down the phospholipid bilayers. It releases that RNA. Once this is broken apart, then this virus can't attach to the ACE2 receptor, and it can't cause an infection. So soap is important. Okay. So how does SARS-CoV-2 get into your body in the first place? How does it get on your hands in the first place? So the virus is being produced by the cells of a person infected with SARS-CoV-2. They're leaving the person's body in tiny droplets of saliva given off when you breathe, when you talk, when you laugh, sing, cough, or sneeze. You can breathe those droplets in if you're close to that infected person. It's amazing how often those droplets land on you and you weren't even aware that it happens. Or they can land on your skin or on surfaces that you touch. Your skin does a really nice job of protecting you from the viruses. They can't get through the dead cells, but the virus can infect living cells in your mucous membrane, such as your eyes, nose, and mouth. And that's why you don't want to touch your eyes, nose, or mouth, because you could be transporting viruses there and causing an infection. By washing your hands frequently, you get rid of the viruses that you've picked up on your hands, at least until you pick up some more. Okay, so you may have picked some up the class period before this. You come in, you wash your hands, you've reduced your viral load. You probably pick some more up in class. You might pick some more up in class, but you can wash at the end. And once again, you have less opportunity to transport those viruses to your eyes or nose or mouth. Okay, a frequent hand washing makes it less likely that you will infect yourself with someone else's viruses. By the way, mask wearing reduces the chance that you'll breathe in someone else's respiratory droplets. It's even more useful in keeping your respiratory droplets from getting into the air and onto surfaces where others could pick up the virus from you if you happen to be infected. So, wear a mask to keep from spreading respiratory droplets. There are also some Another way of viruses can get around is called aerosolized viruses. Some viruses get carried into droplets so small that the water around them, the mucus actually evaporates, and the viruses themselves are less floating around the room, and those can be breathed in. So your mask helps keep those from being spread around. You wear a mask to prevent or reduce the number of respiratory droplets and aerosolized viruses from getting into your lungs. Also, fewer viruses. If you do take in some viruses, if it's just a small number of viruses, you're more likely to have a mild infection. If you get a big dose of viruses, you're more likely to have a more difficult and more dangerous infection. Don't touch your face, especially your eyes, nose, and mouth, and wash your hands frequently to reduce that viral load, to reduce the chance that you're going to pass this to yourself. So, wash your hands. We'll talk about doing that well here in just a minute. You want to use soap and water because it removes the dirt and mucus that viruses are embedded in. It breaks apart the plasma membranes of viruses, destroying them, and it actually physically washes the viruses off of your skin.